Cardiovascular disease causes and symptoms. The cardiovascular or circulatory system supplies the body with blood. It consists of the heart, arteries, veins and capillaries. Cardiovascular disease is now the most common cause of death worldwide. However, there are many ways to reduce the risk of developing these conditions. There are also many treatment options available if do they occur. The treatment, symptoms and preventing of the conditions that are part of cardiovascular disease often overlap. Types. Cardiovascular disease comprises many different types of condition. Some of these might develop at the same time or lead to other conditions to diseases within the group. Diseases and conditions that affect the heart include angina, a type of chest pain that occurs due to decreased blood flow into the heart, arrhythmia, or an irregular heartbeat or heart rhythm, congenital heart disease, in which a problem with heart function or structure is present from birth, coronary artery disease, which affects the arteries that feed the heart muscle, heart attack, or a sudden blockage to the heart's blood flow and oxygen supply, heart failure, wherein the heart cannot contract or relax normally, dilated cardiomyopathy, a type of heart failure in which the heart gets larger and cannot pump blood efficiently, hypertrophic cardiomyopathy, in which the heart muscle walls thicken and problems with relaxation of the muscle, blood flow and electrical instability develop, mitral regurgitation, in which blood leaks back through the mitral valve of the heart during contractions, mitral valve prolapse, in which part of the mitral valve bulges into the left atrium of the heart while it contracts, causing mitral regurgitation, pulmonary stenosis, in which a narrowing of the pulmonary artery reduces blood flow from the right ventricle or pumping chamber to the lungs, to the pulmonary artery or blood vessel that carries deoxygenated blood to the lungs, aortic stenosis, a narrowing of the heart valve that can cause blockage to blood flow leaving the heart, atrial fibrillation, an irregular rhythm that can increase the risk of stroke, rheumatic heart disease, a complication of strep throat that causes inflammation in the heart and which can affect the function of heart valves, radiation heart disease, wherein radiation to the chest can lead to damage to the heart valves and blood vessels. Vascular diseases affect the arteries, veins or capillaries throughout the body and around the heart. They include peripheral artery disease, which causes arteries to become narrow and reduces blood flow to the limbs, aneurysm, a bulge or enlargement in an artery that can rupture and bleed, atherosclerosis, in which plaque forms along the walls of blood vessels, narrowing them and restricting the flow of oxygen-rich blood, renal artery disease, which affects the flow of blood to and from the kidneys that can lead to high blood pressure, Raynaud's disease, which causes arteries to spasm and temporarily restrict blood flow, peripheral venous disease or general damage in the veins that transport blood from the feet and arms back to the heart, which causes leg swelling and varicose veins, ischemic stroke, in which a blood clot moves to the brain and causes damage, venous blood clots, which can break loose and become dangerous if they travel to the pulmonary artery. Blood clotting disorders, in which blood clots form too quickly or not quickly enough and lead to excessive bleeding or clotting. Buerger's disease, which leads to blood clots and inflammation, often in the legs, and which may result in gangrene. It is possible to manage some health conditions within cardiovascular disease by making lifestyle changes, but some conditions may be life-threatening and require emergency surgery. Symptoms. Symptoms will vary depending on the specific condition. Some conditions, such as type 2 diabetes or hypertension, may initially cause no symptoms at all. However, typical symptoms of an underlying cardiovascular issue include pain or pressure in the chest, which may indicate angina. Pain or discomfort in the arms, left shoulder, elbows, jaw, or back. Shortness of breath, nausea and fatigue, lightheadedness or dizziness, cold sweats. Although these are the most common ones, cardiovascular disease can cause symptoms anywhere in the body. Lifestyle tips. People can take the following steps to prevent some of the conditions within cardiovascular disease. Manage body weight. The National Institute of Diabetes and Digestive and Kidney Disorders advise that if a person loses 5 to 10% of their body weight, they may reduce their risk of developing cardiovascular disease. Get regular exercise. The American Heart Association recommend doing 150 minutes of moderate to intense physical activity every week. Follow a heart-healthy diet. Eating foods that contain polyunsaturated fats and omega-3 such as oily fish alongside fruits and vegetables can support heart health and reduce the risk of cardiovascular disease. Reducing the intake of processed food, salt, saturated fat and added sugar has a similar effect. Quit smoking. Smoking is a key risk factor for almost all forms of cardiovascular disease. Although quitting can be difficult, taking steps to do so can drastically reduce its damaging effects on the heart. Causes. Many types of cardiovascular disease occur as a complication of atherosclerosis. Damage to the circulatory system can also result from diabetes and other health conditions such as a virus, an inflammatory process such as myocarditis, or a structural problem present from birth. Congenital heart disease. Cardiovascular disease often results from high blood pressure, which produces no symptoms. It is therefore vital that people undergo regular screening for high blood pressure. Prevention. Many types of cardiovascular disease are preventable. It is vital to address risk factors by taking the following steps: reducing the use of alcohol and tobacco, eating fresh fruit and vegetables, reducing salt, sugar, and saturated fat intake, avoiding a sedentary lifestyle, particularly for children, adopting damaging lifestyle habits such as eating a high sugar diet and not getting much physical activity may not lead to cardiovascular disease while a person is still young, as the effects of the condition are cumulative. However, continued exposure to these risk factors can contribute to the development of cardiovascular disease later in life.